Good morning. My name is Dr. Pankaj Agarwal. I am a neurologist at the Global Hospitals in Mumbai. And the question for today is, what do you do when someone gets a seizure or a fit at home? So, when you see the person, you need to move the person if the person is in a place where he can be in danger, he or she can be in danger. For example, if the seizure has happened in the middle of a road or in any other public place, then you should move the person to a safer place. Now, usually the person is convulsing, so the hands and legs are moving. So you place the patient on the ground in an open area and cushion the head of the patient. You turn the patient to one side so that secretions in the mouth are not swallowed by the patient, and this can be dangerous. So turn the patient's head to one side and head and body to one side. Now, avoid putting anything in the mouth of the patient. For example, people often put like a spoon or their own fingers trying to separate the jaws of the patient. So this is to be avoided because this can lead to tooth injury, etc., and does not help. In our country, they can use like a slipper or a piece of onion, etc., to try and arouse the patient, but this is not helpful and this should be avoided. So what you can do is, after you have positioned the patient, if the seizure does not stop in a few minutes, then you need to take the person to the hospital. So most seizures stop within 2 to 3 minutes. So when do you take the patient to the hospital? If the seizure lasts longer than 5 minutes, if the seizure has happened for the first time in the patient's life and you don't know what the cause of that seizure is, so obviously you have to take the patient to the hospital and find out. The doctor will examine, and again CT scan, etc., may be required. Also, if the patient has not regained consciousness and continues to be unconscious after a few minutes, naturally this is also a situation where you would take the patient to the hospital. Or if the patient is getting repeated attacks of seizures and without regaining consciousness in between. So these are all situations where you would take the patient to the hospital. Now, what are the causes of seizures? So seizures can be because of a number of problems in the brain. So a rupture of a blood vessel or blockage of a blood vessel or a swelling in the brain or a tumor in the brain. Sometimes the CT scan is normal and seizures can be because of a familial tendency to seizures. So these are all causes of why people can get seizures.